I want to welcome again, everybody. This is Dr. Duffy McMahon, our behavioral sleep medicine specialist at Valley Sleep Center. And I will share my screen now, and you can take it away.
Hey, thank you so much. I liked your little story because that's kind of how I got involved in medical marijuana myself. I had massive migraines and couldn't sleep. And I had a neurologist take me off of all my medications for about 6 weeks. And he said, "You're going to be miserable." And I was. And then he told me, "I want you to go see a holistic doctor or homeopath and get a medical marijuana card and do that." He says, "It will help you sleep. It will help calm things down." And then he said, "Don't you dare tell anybody I told you to do that." So I thought that was funny. So that's how I got involved. And plus, my background is that I have studied aspects of medical marijuana and the history of psychedelics over the years. It's been just kind of a hobby. But when it comes to cannabis, CBD, and sleep, the thing is, well, what's the difference in it? Cannabis and CBD. Okay. CBD oil is just that. It's part of the plant and it's the oil, but it does not have any of the psychoactive aspects to it. So you can get it over the counter. The THC, which is the cannabis, does. And so what happens is both of them can help you with sleep and both of them can help you with pain. And a lot of times it's the pain and the discomfort that have you have a problem with sleep. So they can both deal with that. CBD easier because you could get it. THC will be easier because now you can get it. How do they help with sleep? CBD basically bypasses you in stage 3 sleep and causes a reaction to where you don't feel tired the next day. So you feel like you're refreshed, even though you don't really go into deep sleep. THC is more of a healing aspect. It is more of a medication. And that when Laura, you talked about the possibility of being addictive, it can be and it can't be. You don't really get addictive as much as you get a dependency on it. And so do they help with sleep? Both of them help with sleep in a number of ways. They've used THC or cannabis for years to help relax you. The quality of the cannabinoids in THC helps relax you and puts you into a nicer, more calming mood. And that's how it really got started. And if you ever look up the history of how it got to be a class 1 drug, that's a totally different story. But they do help with sleep. They help relax the body. And in doing so, relaxing the body helps with your pain level and it helps with your ability to sleep. So it does 2 things. There are so many forms that you can take that is just insane because you can do, both CBD has tinctures and so does THC. They have vaping, both of them, and they have edibles. Only THC, only the cannabis do you smoke. That's where I have a problem. Because when you smoke it, it's like smoking anything. You're putting it into your lungs, and on a personal basis, I don't think that's a good idea. And you also have a hard time determining how much you're getting. So instead of just going into that relaxed stage when you're having a very small amount, you go into your high, and that takes you into a totally different aspect of taking marijuana or taking cannabis, and it doesn't have the same effect on the body. Okay, it doesn't allow you to sleep that well. In fact, it can be more harmful. The doctors over at Harvard that have studied the CBD and THC, especially THC, talk about any of the doses should be relatively small, under 20 milligrams, very, very low, which is why you look at the edibles might be a little bit easier for you to do because you can find out in edibles that the edibles are only, 15 milligrams or 10 milligrams. So you can be able to say, this is all I'm going to take, and take that little gummy bear or the edible at that time. And people say, well, what time do I take it? Well, I, in talking about, cognitive behavioral therapy for sleep and insomnia, we talk about setting up your pre-bedtime activities. So I'm the one that says if you're going to do any of that, that's when you do it, because you're not going to take it right when you go to bed. It needs time to activate and time for you to relax and to go in through your body. But so when we talk about the difference between CBD and THC, that's the big question. CBD is not a psychoactive, THC is. That's the huge big difference. They all come from marijuana plants or hemp plants. They all come from the same place, but the THC is the different part of the plant that provides the psychoactive aspect of THC to grass or to medical marijuana. And CBD is the oils from the hemp or the leaves. So that's the difference between the two. How do they work? Good question. They work on parts of your brain that allow you to calm down. They're a sedative. A THC is a sedative. People say, well, isn't that like alcohol? No, alcohol is a depressant. It may make you tired, you may want to go to sleep, but it's a depressant and acts totally different on your body. THC is a sedative, and it makes you feel relaxed, and it makes you feel that you can go ahead and sleep, and you want to sleep. Is one better than the other? Questionable. Some people do not like the aspect of having any type of psychoactive drug going on in their body, and it's a personal thing. And CBD does work. THC, on the other hand, works a little bit better because it is that sedative. And let's see, the THC also has the part where it doesn't take you into keeping into lighter stages of sleep. What it does is it will kind of bypass REM. So if you're having sleep issues because you got PTSD, that's going to be great, because that in REM sleep is whenever you start to have your dreams and your nightmares. And so they've used the THC with PTSD patients and done a lot of research with that, especially for our military. We have a wonderful Dr. Sue Sisley in town who has done research on PTSD and cannabis for years. So that's why one really is not better than the other. Depends on what you like. Okay. Some people, like I said, don't want the psychoactive, so they're going to do the CBD. How much do you take? But we talk about, okay, so what is it? I hear about these little things. What is indica? What's sativas? What are hybrids? Those are actual aspects, types of cannabis. The indica is normally what you use because it has most of the all of the activations for the sedatives to make you sleep, to make you tired. Sativas are normally used during the day because they help you become more active and more aware. And people that have had severe ADD, ADHD will take sativa because it helps them with their ability to focus. And then the hybrid is just what they make up in the dispensaries based off of putting the two together, whether it be a combination of indica and sativa, or indica, sativa, and CBD. They'll make up their own aspects of a hybrid of it. So that's what you're looking at. How do you take it? So there's tinctures, which is the little oils. You put it under your tongue, or you just go straight down into your throat. The edibles, which are normally gummy bears. There's some cookies. There's some teas. There's all kinds of different things for edibles. The vaping is like you're seeing now with what the kids are doing with instead of cigarettes, which is the vaping. And that's all that CBD comes in. THC, you have the tinctures, the same thing. You can take it that way and have more control over how much you're taking. The edibles has more control. The vaping and the smoking, you can't necessarily control the amount that you're taking. And so if you want to smoke it, they say, okay, well, you may not do more than maybe 2 puffs because that's more than you need. Anything more, you're going to go into a high and it's going to defeat the purpose. How do I determine how much I take? the best thing is hopefully you go to a dispensary that has somebody on hand that can talk to you about dosages. Because we don't know. As I said, the Harvard professors right now are saying low dosages are the best for you. Anything other than that can cause you not to get the effect that you need for the sedatives for sleeping or even for pain. So they're talking about it should be under 20 milligrams, which is a very, very low dosage. You can't necessarily control that if you're smoking or vaping. So determine on how much you take, that's the best way. If you're doing a tincture, you're going to start out with a little bit start out with a half of a tincture. And then if that works, great, keep it at that. If it doesn't, then add a little bit at a time. It's like anything else. Start out low and then add on just a little bit if you need to. But I really prefer that you talk to a doctor that is known for being able to take care of, I guess, medical marijuana and how much that you need. And most of the dispensaries have that, but make sure that they have somebody that has knowledge on hand, because you don't want to go in and all of a sudden don't know anything that you're doing and talk to one of the people behind the counter and they say, oh, here, take this, this, or this, and you have no idea, one, what that you're getting, what strain you're getting, because each strain has a number of substrains in them. And then you need to be able to say, I don't want to take more than this. And so smoking is probably not the best way to go. I talk about words of caution when it comes to taking medical marijuana. I think medical marijuana has some wonderful, wonderful aspects to it and can help you out. But if you're going to do it wisely. Go to a dispensary that has a medical professional on staff. Don't just try it on your own. Say, okay, I got this, or my buddy gave me a joint and I'm going to try this. Don't do it. It's not good. You're going to have a bad experience. There was an article written by Marianne, I went blank on her last name, but she was a columnist for the New York Times. And she was talking about cannabis. She went into a dispensary and got some of the candy. Well, they didn't tell her that she's only supposed to take a small portion of the candy. She ate the whole candy bar and really went into a very, very bad state of affairs and was almost hospitalized for a couple of days because of it was so overpowering and such a huge amount of cannabis that you don't even smoke that much because it's in a concentrated amount in a candy bar. And most people don't think about that. Oh, it's a candy bar, it's a cookie, it's whatever. But it doesn't necessarily say you're only supposed to have a quarter of this or you're only supposed to have a tenth of this. That's why I say words of caution. When you go in and you decide you want to try it out, it can be very good for you. It can really help you out on so many bases. It can help you sleep. It can help you with pain. But like anything, it is a medication. And you shouldn't mess around. It doesn't matter whether it's a medication for sleep over the counter or prescribed. Be aware of what that you're doing. Be aware of what you're putting in your body. Is that pretty good?
Right.
So, no, right. It's a fascinating subject, and more is coming out. And now that it's becoming legal in more states, what I want people to do is be aware of what that they are doing and be smart about it.
Right. Always. That's why you need a medical card to do
Right.
here in Arizona. A doctor you should be under a doctor's care if you are using it. Okay, so why don't we take some time to answer your questions. If you're on Facebook Live, you can chat them in the comments. I have it right here. And then on our webinar here, welcome everyone again. If you were logged on after I welcomed you. Let's see. Can you talk a little more about the dependency aspects of CBD?
Okay. When I talk about dependency, there's a big difference between being addictive and being dependent. Okay, CBD does not have addictive qualities. It's an oil, it's non-addictive. It does not have any psychoactive aspects to it. So you don't get addicted to CBD oils. You don't really get addicted that much to marijuana unless you're smoking on a daily basis for a long time, and then it will kind of fry your brain. So you don't want to do that. So to me, CBD oil is fine. It's non-addictive. And I would not worry about that. You know, again, if you are, talk to your doctor about it. But I have never known of anybody, any place that has become addicted to any CBD oil because there's no addictive qualities to it.
Someone's asking, what are the costs, and do insurances cover the cost?
No. No, insurance does not cover the cost. Huh? Yeah, we only wish. No, it depends. If you have your medical marijuana card, from what I understand, even with the change in the law, that people on a medical have a medical marijuana card will be able to get it at a reduced price than those that just want to have it for recreational use.
Oh, interesting.
Depending on a personal basis, if I go in and I buy a small bag of gummies that will last, that's probably about 15 gummies, will last for about a week and a half. It's $30.
Yeah. So
and that's for my gummies that I know are only 15 milligrams.
Oh, here's a great question for you. Do you have a recommendation for weaning off of prescribed sleep medication and maybe going to THC? She just got her card again, but her physician is not pro medical marijuana. And I will just tell you, most physicians, we would like you to sleep without any medicine and without any sleep aids. And that's where we have Dr. Duffy. So Dr. Duffy, take that.
Well, you said it brilliantly. You really did. We would prefer you not be on sleep aids. One of the things about sleep aids, whether it be Ambien, trazodone, whatever it is that you are on, you don't get a good sleep. Yeah, pick one. But what happens is that the qualities will help you fall asleep. It may not make you stay asleep, and it may not give you rested sleep because it doesn't take you beyond a step 1 or step 2 sleep stage, which is very light. So you're not getting a good night's sleep to begin with. And so that's one of the reasons. And by the way, sleep aids are addictive. They've got addictive aspects to the chemicals used. So that's number 1. How do you go off of them? You talk to your prescriber. I'm not a prescriber. I don't prescribe pills. I don't even prescribe, medical marijuana. I say, if you want to try something, talk to your doctors about it, because I'm not a medical doctor. I am a sleep specialist, and I'm actually a doctor of human sexuality, and they all go together. So
you know what I want to be addicted to what you prescribe is mindset.
Oh yeah.
I want to be addicted to mindset, and that's what she prescribes. She prescribes mindset and will help you learn how to yourself,
how to be able to fall asleep, how to be able to get out of our regular craziness during the day, how to be able to take time to relax. Cognitive behavioral therapy for insomnia is just that. It's helping you relearn what to do to let go of the day. It sounds simple, but it's not. When it comes to medical marijuana, when it comes to any of the sleep aids, I would prefer you not being on, because you're not going to be getting a good night's sleep. And the other aspect of it is that you then have to wean yourself off. If you've been on Ambien, I've had clients and patients that have been on Ambien for 30 years. It was never meant to be that. It wasn't meant to be something that you're on. And then the first thing they say was, well, I can't sleep without it. Okay, well, have you tried? And it may take you a while, but in order to do that, you have to wean. You can't just all of a sudden stop, because if you do look at any of the aspects of what you look at and say, oh, look at the label here. It can cause this, and death. I sure understand that. But anyhow.
Okay. Sorry about that. I got more questions.
Okay. So anyhow, you have to wean off of it. It's the best way.
Great. I tend to feel groggy, and I actually get migraines the night after I take CBD, but I keep hearing that it actually cures headaches and migraines for others, and some report waking up feeling refreshed. Might you know why this is?
Okay. I've never used CBD oil for migraines. Okay, that's the one thing I can say. CBD oil does not have the sedative in it, does not have the THC. When I was told to start taking it for migraines, it was a matter of it had the THC. I said it was medical marijuana, is what he had me on. And he explained to me that the THC, the sedative of the THC, would help both calm down the ability to relax, and also because it helps with pain, alleviate some of the inflammation that is associated with migraines. So I can't speak on behalf of CBD oil and migraines.
Well, and I would just make sure that you had a sleep study, because if you have migraines, those can be a secondary, a symptom of having some sleep apnea. So if you haven't had a sleep study, I would recommend that. How effective are hybrids, Dr. Duffy? Some dispensaries have switched from indica to hybrid, and I certainly don't need something to pump me up at night. Sure.
Well, you have to find out what the percentage of hybrids are. First of all, okay, when you're talking about a hybrid, what are you saying? Half and a half? A quarter, 3/4? What is it? What are you talking about? Some people like it because again, the hybrids, and when it comes to sativas, they're more to help you out during the day. It might be that you are so jacked up during the day, you need to have that aspect of indica in it to help you balance out. I'm not a big proponent of hybrids. I talk to them about what it is that is in it, and I haven't found it to be very beneficial. And whenever I've tried a hybrid, it hasn't worked for me. So when it comes to medical marijuana, when it comes to CBD, what is going to work for you? Okay, it may take you a couple of different times to find out, just like it may take you 2 or 3 times to find out if you take more than 10 milligrams, what it does. So you might need to go up to 15. You might need to go up to 20, and then watch it from there.
All right, so last question. I think I've gotten most of them. Is it safe to use CBD or THC products with obstructive sleep apnea that's being treated with CPAP therapy? I'll let you give your opinion, but I personally say, as long as your sleep doctor knows that you're doing this and that we're looking at your download to make sure that the CPAP is effective, we can actually do that. So don't be afraid to let us know, exactly what you're doing. We need it on your chart, all your medications, whether it's recreational or prescribed. That way we can help you, because you might actually sleep deeper if you're using a product like THC. And so we want to make sure you're not having apnea. We really want to look at that and make sure. But do you have a comment on that?
I agree wholeheartedly with you. That is one of the things that I say. But then again, I ask a lot of people if they're having problems with insomnia, have they had a sleep test? Because apnea can be a byproduct, insomnia can be a byproduct of apnea. Yeah. So we know a lot of things about what's going on with your sleep before we make decisions. And I'm right with you. Tell the doctor exactly what you are. Also, the milligrams. If you are on a higher dosage of THC, it will affect how deep or how shallow you are when it comes to sleeping. So we want to make sure that you're okay. That's our biggest thing, is we're concerned with you and getting a good night's sleep.
All right. So somebody else says, I've used 5 milligrams of CBD and 5 milligrams of THC gummies, which seem to work well. Would this be considered a hybrid? Yes.
Well, they're a type of hybrid. Not most dispensaries do not necessarily do CBD oil and THC together. Some do. But I find that the hybrid with the oils and the THC have been beneficial for some people because they don't need that much. Okay, 5 milligrams of THC is enough for them, and if the oil is helping out, the oil will make them tired, will help them with their ability to relax. But the oil also works more on pain.
So the CBDs are actually anti-inflammatory. Mm-hmm. Yeah. I'm sorry. The hybrid, I think, are the sativas and indica, and I learned that indica is like couch, like yes, you would like want to go to sleep, right? So those are the ones that have the psycho, effects, and they want to help you sleep. And then the sativas are more stimulating. So yeah, you wouldn't want something, you wouldn't want sativa if you're trying to fall asleep at night. So I think
one of the things, like I said, I found when it comes to helping people during the day using sativa is if they have any type of ADD, it will help them focus more. That's the only thing I've ever really known it for in the day, unless somebody just likes to smoke, and I don't recommend that.
Yeah, that's good to know. All right, well, I want to just thank you. It's 6 o'clock. This was great 30-minute presentation. If you guys have any other questions, feel free to reach out to me. You're going to get an email, or valleysleepcenter.com. That Ask a Sleep Coach box comes directly to me. If you want help getting off your sleep aids, medication, and you want to be like me now, where I take nothing to go to sleep, I really highly recommend cognitive behavioral therapy. That's what Dr. Duffy does. You can make an appointment with her. Just send me an email and I will facilitate that. It's all covered by insurance. We just want to make sure you don't have any sleep disorders. So you'll see one of our medical providers first, and then we'll get you over to our behavioral sleep medicine specialist, Dr. Duffy.
Thank you.
Thank you, Chuck, for all of the technical services. It's good to
I can't live without him.
Yes, I know. He's great. And thank you, everyone, for all of your questions and participation. We will see you soon. Bye.
Bye.